What is HPV? HPV, or human papillomavirus, is a common virus that only infects humans. In fact, there are more than 200 types of HPV, and different strains infect different parts of our bodies. Some strains infect our external lining, or our skin, while others infect the internal lining of our bodies, or the mucosal surfaces, such as those of the tongue, throat, anus, and genital regions. These strains infecting the mucosal surfaces are transmitted by oral or sexual contact between people. Some of the strains can cause cancer, while others simply cause non-cancerous growths, like the common skin wart. HPV infection is exceedingly common. About 80% of sexually active humans will have an anogenital exposure and infection at some point in their life. Although most infected people won't realize this, as the virus doesn't always cause symptoms. At any given time, up to 15% of men and 5% of women will have an active throat infection. What's more is that some folks can quickly cure the infection on their own, but in others there can be a long-lasting infection, and the body doesn't heal this quickly. We don't yet know why this is the case. What we do know is that the more sexual partners and exposures to HPV a person has, the more likely it is that he or she will have a long-lasting infection. Long-lasting infections with certain strains puts people at increased risk of developing an HPV-related cancer. HPV cancers involve the oropharynx, or our tonsils, the very back of the throat or tongue that's not visible when looking through the front of our mouths. Oropharyngeal cancer is the #1 HPV-related cancer in the United States. HPV can also cause anal cancer, gynecological cancers in women, or penile cancers in men. Sadly, there's no standardized screening tool yet available to see if a patient is infected with HPV outside of some pap smears for women.